Hey, welcome to The Explainer. Today, we are diving deep into a skin condition that so many people have, but honestly, it's often really misunderstood. We're talking about rosacea, and you're about to see it is way more than just a little bit of blushing.
So have you ever had that thing where your face gets red or flushed and it just sticks around, way longer than it should? Maybe after a spicy meal or a good workout, that blush just doesn't seem to fade away. It's easy to think, oh, I just have sensitive skin, but what if it's actually something else?
Well, there's a good chance it could be this, rosacea. It usually shows up right in the middle of your face. We're talking cheeks, nose, forehead. And while it's super common, especially for folks with fair skin between the ages of 30 and 50, it gets misdiagnosed all the time.
Okay, so what is the official definition? Well, doctors call it a chronic inflammatory disease. Now, the two big words to remember there are chronic and inflammatory. This isn't just some rash that goes away. It's a long-term thing that has flare-ups. So in this explainer, we're going to break down what causes those flares, how the condition can progress, and most importantly, how you can get a handle on it.
All right, first up, the investigation. One of the absolute biggest parts of managing rosacea is figuring out what makes it flare up in the first place. We don't know the single exact cause just yet, but what we do know is that certain triggers can really kick the symptoms into high gear. Now, this is fascinating. It's not just what the triggers are, but how huge they are. I mean, think about this. In a survey of over 1,000 rosacea patients, a whopping 81% said sun exposure was a trigger, and 79%, almost just as many, pointed to emotional stress. That's a huge insight, right? It tells us that managing this is about so much more than just what you put on your skin. It's tied directly to your environment and even your mental well-being. And yeah, the list definitely does not stop there. So many things in our everyday lives can set it off. That hot cup of coffee in the morning? It might be the heat itself, not even the caffeine. That great run you went on? The exercise, the wind on your face? That could cause a flare. Even using the wrong kind of face wash can do it. The main thing to get here is that everyone's triggers are a little different, which is why keeping a diary of your flare-ups can be an absolute game changer.
So beyond things like the sun, researchers are also looking at what's living on our skin. And this part's a little wild. We all have these tiny microscopic mites called demodex that live on our faces, totally harmlessly. But here's the thing. Studies show that people with rosacea often have way more of them. The big question for scientists is, are the mites causing the inflammation, or does inflamed skin just create a better home for them to multiply? Either way, it's a really interesting connection that's leading to some new treatment ideas.
Now, it's really important to understand that rosacea isn't just one thing. If you don't manage it, it can actually be progressive, and it tends to move through these pretty distinct stages. So let's take a look at what that journey can look like.
So it usually starts out at stage 1, with that flushing that comes and goes. But then, in stage 2, that redness might decide to stick around for good, and you might start seeing tiny little broken blood vessels on your cheeks. Stage 3 is when you can get bumps and pimples, which is a big reason it gets confused for acne. And finally, stage 4 can actually affect your eyes, making them feel gritty or irritated. And for some people, it can cause the skin to thicken up, especially on the nose. That's a condition called rhinophyma.
And this, right here, shows you exactly what we're talking about. On the left, you've got that persistent redness from an earlier stage. But on the right, you can see how it's developed into those bumps and pimples. It's such a clear visual of why getting an early diagnosis and starting to manage it is so important. You want to stop it from moving to that next stage.
Okay, so we've defined the problem, we've hunted down the triggers, and we've tracked how it can progress. Now for the most important part of all, the action plan. And here's the good news. While rosacea is a chronic thing, it is absolutely manageable if you're proactive about it.
Everything really starts right here, with these 3 basic steps. First, you've got to become your own skin detective. Figure out what your personal triggers are, and then try to avoid them. Second, since we know the sun is the #1 enemy here, daily sunscreen, broad-spectrum SPF 30 or higher, is completely non-negotiable. Seriously. And third, just be nice to your skin. That means using gentle, soap-free cleansers and staying away from harsh scrubs or anything with a lot of alcohol.
But look, sometimes lifestyle changes just aren't quite enough to get the inflammation under control, and that is perfectly okay. That's the moment when it's time to see a dermatologist, because they have a whole toolkit of medical options that can help you get those symptoms back in check. This chart breaks it all down so well. So for those bumps and pimples, a doctor will often start with topical creams. These have ingredients that directly calm the skin's inflammation right on the surface. Now, if things are a bit more severe, they might prescribe oral antibiotics. But, and this is important, it's not to kill bacteria like a normal infection.
They're used for their powerful anti-inflammatory effects that work from the inside out. And for that stubborn redness and those broken veins that just won't go away, laser and light therapies can be amazing. They basically zap and shrink those visible blood vessels.
Okay, so let's bring this all home. What's the big takeaway here? What does it really mean to live with rosacea day in and day out?
This is probably the #1 question on everybody's mind, right? After all of this, can you actually cure it? Can you make it go away for good?
And the honest-to-goodness answer is no, there is no cure. But, and this is a really big but, it is an absolutely manageable condition. The goal isn't some one-time fix. It's about long-term control. It's about keeping those flare-ups to a minimum so your skin stays calm, clear, and comfortable. Using that combo of lifestyle choices and, when you need it, medical treatment.
And that really brings us to our final thought. Instead of feeling overwhelmed by all this information, just focus on one small thing you can actually do. Maybe it's finally committing to wearing sunscreen every single morning, no excuses. Or maybe it's just switching from a hot coffee to an iced one. Or hey, maybe it's just deciding to be a little kinder to your skin. So, what's one little change you can start with today? Thanks for joining us on The Explainer.